Hello everyone, good afternoon. I'm Dr. Joshitha Naik, consultant gynecologist at Apollo Cradle, Jayanagar Bangalore. Today I've chosen a very important and very pertinent topic of about normal delivery and tips to achieve a normal delivery. So why is it so important, so relevant in this era? Because we are seeing an increase in the incidence of operative delivery or cesarean births. So it is very important to stay aware and to be prepared to achieve a goal of normal delivery. So I thought I'll just give you a little bit insight into what is the process of the normal delivery and how best you can be prepared to go through the same. So coming on to what is a normal delivery, it's also called as a vaginal birth, wherein the baby along with the placenta comes out through the birth canal at the end of 9th month, and this usually happens spontaneously, and we have a good outcome whether it's to do with the mother or with the baby. So these are the few goals that we look at when we are talking of a normal delivery. So coming on to what are the benefits? Why are we stressing so much on focusing on a normal delivery? It is beneficial both to the mother as well as to the baby. Coming on to the benefits to the mother, it is a process of a natural childbirth. This is something that has been going on for several years. From as early as we can date back to history, women have always delivered naturally, and their bodies are geared up to go through the process of childbirth. The advantages of going through a process of normal delivery for a woman would be that she experiences less pain, she is more ambulant, as in soon after the delivery process she is able to get up and continue with the care of the baby, as well as initiate breastfeeding very early, which is very important for the baby. And there is less complications with respect to undergoing a surgical process, which involves complications related to either anesthesia or even blood loss or even other major complications which can happen with any surgical process. And coming on to the benefits to the baby, why is it important that the baby goes through a normal labor? So when the baby goes through labor, the fluid which is there usually in the baby's lungs, which is usually there when the baby is inside the mother's womb, the lungs will get compressed when the baby is coming out through the birth canal. So this again helps the baby to breathe better and to cry at birth. And the second thing is the vagina or the birth canal does have a lot of these microbial organisms, what we call as the vaginal microbiome, which again gives a lot of positive bacteria to the baby, which again helps to build up the immunity of the baby. And again, these babies can be initiated with lactation, and rooming in can be initiated immediately at birth. That is, as soon as the baby is born, the baby is placed on the mother's chest, and immediately lactation can be initiated. This definitely plays a lot of not only, I would say, physical as well as to build up the immunity of the baby. It also helps to develop a very strong emotional bondage between the mother and the baby. So these are the few benefits as to why a woman should go through the process of a normal delivery. Coming on to how do we achieve these goals, or what are the tips for having a normal delivery? So do you think that it starts at pregnancy? I would say maybe it starts a little earlier. So I would say look at having a planned pregnancy. So when you have a planned pregnancy, you are physically more prepared to go through the pregnancy, as well as emotionally prepared to go through the process of pregnancy and labor. So having a planned pregnancy, going through the process of a preconceptional counseling and meeting a gynecologist, checking into your health to see if you are fairly meeting the ideal norms that is required to go through the pregnancy, definitely helps. because ultimately we would be able to achieve a normal delivery only if your pregnancy has been going on healthy and good all through the 9 months. So when you come in for your pre-pregnancy counseling, we do check in on your health, as in we do check in for any anemic status, we do check in on your sugars, because there is a definite rise in the incidence of diabetes which we are seeing nowadays in India. So all these factors can be corrected, and then you can have a planned pregnancy. So coming on to what you could do in your pregnancy. So again, I will discuss this trimester wise. So like you all know, pregnancy is divided into 3 trimesters, fairly around say 3 months we allot to each trimester. So in the first trimester, of course, your body is still gearing up. It is still adapting to all the hormonal changes which are happening. So a lot of you may be experiencing a lot of discomfort in terms of nausea, not able to eat. Some of you may even experience a lot of weight loss that happens because of the excessive vomiting that sets in. And you generally feel a little lethargic and very restless sometimes. So we encourage you to just be active in your first trimester. Don't kind of push you towards doing a lot of hardcore exercises. So a simple light walk every day to kind of make you feel better definitely helps. So it also keeps you physically active, it improves your appetite, as well as it elevates your mood. So you definitely feel better during the first 3 months. So I would say in the first trimester, don't bother too much, take care of yourself and get accustomed to the changes which are going on in your body. Coming on to the second trimester. From here is when it is very, very important to take care of yourself. So start reading. I would say knowledge is the key power. So if you are aware, if you are prepared, then you go through things better. So do read about what you could go through each trimester, what are the changes that are happening in your body. Do share your experiences with your gynecologist, whatever symptoms you face, whatever minor ailments that you have, do discuss with your gynecologist. Come in for the correct visits whenever it has been stipulated. So never miss on your pregnancy visits, because there will definitely be more things that you may want to share, as well as the gynecologist may want to kind of inform you and give you little tips as to how to go about in the next coming weeks. So usually we start with antenatal programs or antenatal classes. So what do we do in these sessions? So we basically give you a lot of knowledge as to what are the changes going on in your body, as well as how to identify symptoms of labor and what you could anticipate during your labor. So it is very important to know and understand this rather than just be caught unawares and landing up in the labor room and not knowing what's happening around you. So when you attend these antenatal programs, you are more confident and you are more prepared, which is very important, because ultimately stress can be detrimental to delivery. So keep yourself calm, go through the sessions. During the sessions, of course, the therapist will teach you some stretches, will teach you some pelvic floor exercises, and will insist on regular exercise in the form of walks. And as your pregnancy advances, they will keep adding on more exercises which are beneficial during labor. Especially they add on exercises which kind of help the baby to drop down and get into the birth canal. So do your exercises regularly. And the other thing is focusing on your diet. So generally there is a myth that pregnancy means eat for 2 people. I would say never do that, because all you need extra in your pregnancy is about 300 calories. So do not overeat, because excessive weight gain again could be detrimental to the process of a normal delivery, because again you could have chances of excessive weight gain having a tendency to getting into gestational diabetes, which again can lead to the baby growing very excessively incised, which again can cause problems during labor. So eat healthy, and I would say include a balanced diet. So all you would need is to modify your meal plate, wherein you include enough amount of proteins as well as the unsaturated fats, along with a portion of the carbohydrates. And make sure that you divide your meals and take like small frequent meals, about 5 to 6 meals a day. This again makes you feel lighter, and then you are not very stuffed, you are active through the day, and you are able to go on with your regular activities. Hydrate well. That is again very important in pregnancy, because hydration is the key thing. We don't want you to have any infections during these 9 months, because less hydration, you can be more prone for urinary tract infections. You may need interventions, which is again not a good thing to happen. Reduce your stress levels. So this again can be achieved through the prenatal sessions that you go through, wherein they teach you these exercises, and they also focus on breathing techniques, which is very beneficial during pregnancy as well as during labor. And cut down on any stress inducing factors, be it at work or be it at home. So I think during pregnancy, if you are able to go through these sessions correctly, then definitely it does make you mentally strong to go through the process of labor. So next, coming on to identifying the symptoms of labor. When should you land in the hospital? Is it that with one painful contraction you need to be rushing to the center? What is it that we are looking at? So at the end of 9 months, so when we talk of onset of spontaneous labor, we usually expect it to happen around term, that is after 37 completed weeks. Nevertheless, anytime after your second trimester or third trimester, if you have any of the warning symptoms, which of course your gynecologist will guide you at every visit, briefly saying intermittent, regular, painful contractions which happen and which go on increasing in intensity and frequency. This is what we call as labor contractions. So initially when they start, they would be very erratic. They would be very, say once in half an hour or once in an hour or so. But then if you notice that these contractions are coming on every 5 to 10 minutes, then and they are increasing in intensity, something that was lasting for say 10-15 seconds again increases to say about 30 to 40 seconds, then yes, that means you are getting into labor. So intermittent contractions which are increasing in frequency and intensity, these are all very important factors to identify what is labor pains. So a lot of times women do experience false labor. It could either be because of some underlying infection, or it could be due to underlying other bowel issues like some constipation, or say some kind of indigestion. So usually labor is something different like what I described earlier. Along with this, some of them may not experience labor per se, but they may come in with other symptoms like breaking of the water bag, or they may have reduced fetal movements. So these are all very important symptoms. Or they may start with expulsion of the mucus plug, what we call as the show. So any of these symptoms, when these arise, these are all signs of labor, and this is when you need to get to the hospital. So again, coming on to your entry into the hospital, do not be anxious. Do not be overly stressed about the whole situation. This is a natural process, and this has been going on with everyone. So you can think of your own mother, or maybe your sister. So all of them have gone through the same, or even your grandmother. So for generations, women have gone through labor. So don't be overly apprehensive about going through the same. I would say even familiarize with the surroundings. So if you have identified where you are going to deliver, it is worthwhile identifying, having a visit. Of course, in these COVID times, we don't encourage you to have too many visits into the hospital, but maybe in your 9th month, may be worthwhile getting familiarized with the surroundings so that you are more comfortable. So when you come into the hospital with any of these labor symptoms, what should you do? So first thing is that when you would come in, definitely we would want to assess your condition as well as the baby's well-being. And early labor, usually it is very good to be ambulant as in it is very good to be walking around. You don't have to be tied to the bed, you don't have to be resting all the time. So it is a very good thing if you can walk, because being standing upright definitely helps the baby drop down. That is when, because when we talk about labor, we talk of 3 different stages, or rather 4 stages of labor. So in the first stage is more of the preparatory phase. So we again divide it into a very early, that is a latent phase, where your body is just preparing for getting the baby into the correct position and initiating the contractions, which will help the baby go through the process of labor. So with the first stage, we have the onset of contractions, we have the cervix dilating, we have the cervix shortening in length. And with all these processes in place, the baby's head starts dropping down, and that is when we are able to achieve a full dilatation of the cervix. That will mark the end of the first stage, when the cervix is fully dilated and the baby's head is in the correct position. So the second stage when we talk of is when the baby's head has to be pushed out of the birth canal, that is the birth of the baby. And of course the third stage is after the baby is born, the placenta is expelled. And for technical reasons, we do have a fourth stage wherein we keep you in the labor room, where we monitor you 2 hours following a childbirth. So I would just want to tell you what to do in each stage of labor. This is very important, because there is a lot of fear in the mind, there is a lot of apprehension, there is a lot of concern on how would I be able to go through the pain element, what would happen. So this anxiety is always there in the mind. So I would say trust yourself. We have prepared you for 9 months to go through this. So be patient, be calm, and go through your sessions that you had with your therapist, go through the conversations that you had with your gynecologist, and reassure yourself. So it is also worthwhile identifying a birth partner. So what the birth partner could do is, it would definitely be beneficial if the birth partner could attend the sessions with you, because sometimes when you are going through the process of the labor, pain can be detrimental, as in it cannot, sometimes you may not be able to keep yourself calm and emotionally strong. So the birth partner can remind you to go through the exercises, or remind you to practice the breathing techniques that you have been taught. So it could either be your husband, or it could be your mother, or it could be some older sister who has probably gone through the process of labor. But ensure that you have identified a correct birth partner who is equally motivated as you to go through the process of the normal labor, because the fear in the birth partner should not again cause concerns and increase your fears. So identify the correct person who will accompany you during the process of delivery. So in the first stage, we would say have light meals, because with the pain sometimes you do feel a little bit of discomfort in the stomach, and you may end up throwing up the food. So eat light, stay very well hydrated, walk around in your delivery, in your room, and make sure that you are staying positive, doing all your exercises. So towards the end of the first stage of labor, when the contractions become more intense, sometimes it may be difficult for you to get up and walk around, but do take help of the birth wall, or even you can hold on to a railed cord and try your squats and your butterfly exercises. So these are very important, because these again help to loosen up the pelvic floor, so that the descent of the baby's head is easy. So reinforce all these things that you have gone through in your 9 months. So if needed, if your pains are not very well borne, because see, pain tolerance is something that is very different to each individual. So some of them can't do good by practicing these breathing techniques and practicing these exercises and walking around. They are fairly able to tolerate the pains, but some individuals are not able to really go through this. In that case, you can opt for epidural analgesia. So at our center where we practice, we do have the option of the epidural analgesia, which is administered by the anesthetist. So this is a very safe form of analgesia, and if needed, you can always, just because of the fear of the pain, do not try to change your mode of delivery. Please opt for pain relief methods and do progress with what you have thought of, so that you are able to achieve your goal. So this is an important thing. So don't be worried or don't be anxious about the pain element in labor. So if you are not able to bear it, do discuss it with the gynecologist and ask for pain relief. So coming at the end of the first stage will be the second stage of labor, where the baby's head actually needs to be pushed out. So when this is happening, again, at this point of time, your contractions would be very intense. You would have more frequent pains, which come on, say, with an interval of every 2 to 3 minutes, and the contractions also may last for a little longer, for about, say, 1.5 minutes also. So at this time, it's very important to practice your breathing techniques. So that is important, and stay well hydrated, because again, dehydration can slow down the process of labor. And at this time, we would want to monitor your baby's heart a little more intensely. So we may want you to stay on the bed for a little longer time, but definitely in between you can always do the squats, and you can take the help of the birth ball if you feel more comfortable in that position. So with these measures in place, you can, you would most often be able to push out your baby with the guidance of the gynecologist. So again, the pushing techniques, when it has to be done, how it has to be done, all this will be guided by the gynecologist at the time of the delivery. So you need to stay, at this point of time, it's very important to focus on the baby rather than your pains. So this keeps you motivated that you can achieve your goal. So achieving the process of the normal delivery may sometimes require interventions, wherein we may need to make a small cut in the vaginal opening, that is what we call as an episiotomy. So all these measures we may need to do to help you or to facilitate the process of normal labor and delivery. So once the baby is born, and then we hand over the baby to you in your hands, definitely whatever you have gone through, the element of the pain and all that just vanishes when you see your little one. But yeah, of course, we do look at management of the third stage and the fourth stage of labor, wherein we are looking, again, we are going to monitor your the delivery of the placenta and help do a little bit of assisted delivery for the placenta, and you would be in the labor room for 2 hours following delivery. This is a very crucial phase where you need to initiate breastfeeding. So handling the baby, rooming in, breastfeeding, all these have to be initiated as early as possible after a normal delivery. So I hope I have been able to convey a few tips to achieve the goal of a normal delivery. I would say, trust your instincts, trust yourself, be prepared, be aware of what you have to go through. So then you are physically as well as emotionally very well prepared to go through the process of this normal delivery. I think every mother needs to be offered a process of this normal delivery, unless there is a medical reason to intervene and act otherwise. Thank you.
Very well. First time we had so many viewers.
Yeah.
Highest in